Not a shocker. Heart disease has been the leading cause of death in the United States since 1921. Obviously it transcends all different conditions, and it's highly prevalent. And blood pressure is probably arguably one of the biggest risk factors. I mean, there's other things, cholesterol and other risk factors, but blood pressure is arguably one of the biggest risk factors. And in the United States, over 122 million adults over the age of 20 have high blood pressure. I think about things in two buckets. One is the things that are modifiable, things we can change, and some of the other things are non-modifiable, things we can't change. The things we can't change are family history, genetics, things that we can't change. The things we can change are the things I like to focus on, which are modifiable. And a lot of these things, right, we think about, and I'll say them, and you'll say, well, these are common sense things. But I think one of the things is that these things are hard to do, and I think admitting that they're hard to do gives us some grace. Obviously, we focus a lot on diets, eating a healthy diet, low sodium, high levels of fibers. Fibers reduce cholesterol. Sodium raises blood pressure, so limiting sodium helps out with blood pressure. Getting 150 minutes of moderate intensity exercise per week, that's a lot of time. So scheduling into your week so that you take priority, you put yourself in the highest priority in your health. We all know, I mean, smoking cigarettes and vaping, anything you're inhaling into your lungs is probably not great for your heart. So kind of avoiding these things. Trying to get 7 to 9 hours of sleep, that's a hard one for most folks. Reaching and maintaining a healthy body weight that kind of goes along with exercise. And then importantly, knowing your numbers. So knowing where your cholesterol is, knowing where your blood pressure is, and then knowing a little bit about your blood sugars. If you think about exercise and you think about exercise as a therapy, right? Because that's what we're using it for. When we use medications, right, we have to have just the right dose. And so it's really important to have just the right dose of exercise also. So too little doesn't do much, and too much could potentially even be not great. So we think about it as for regular heart health, it's about 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise per week. That's just for heart health. Now, for weight reduction, you have to double those numbers. So you have to be around 300 minutes of moderate intensity exercise or around 150 minutes of vigorous exercise per week. There's a million diet health books out there. I think overall we can sum up the idea is that eating a heart healthy diet has to do with eating towards a Mediterranean type diet. It's low in saturated fats. It's high in fruits and vegetables. It's low in carbohydrates in that sense of things. I think eating a variety of diet that is low in sodium, high in fiber, and low in saturated fat, and towards a Mediterranean diet would be my answer. One of the things we know about cardiovascular disease is it starts early in life, and there's this period where these risk factors, these things that we think of, kind of damage the blood vessels. And this damage builds up or accrues over time. And then in mid or even later life, that's when people start to see or experience cardiovascular events. So I would argue that sometimes focusing on some of these things, even at younger ages, can have the biggest bang for your buck. And so I think that's where certainly there's guidelines of when to start cholesterol screening and checking blood pressure, but I don't think there's a time where that could be early enough just to kind of at least start to think about how to at least live some of these healthy lifestyles. And then in addition, as you get into young adulthood over the age of 20, starting to really kind of know what your numbers are. With technologies that have grown, one of the nice thing is that we can check blood pressures at home, and there's nice, pretty inexpensive methods to check blood pressure. Most of these are sold in stores around town. We think about an upper arm digital blood pressure cuff where you just push a button, it will measure your blood pressure and give you a reading. And what we're trying to do then is to check the blood pressure outside of the clinic and see where it runs at home. Ideally, we'd love it to be below 120 over less than 75. Those would be great. But that's the ultimate goal. But blood pressure is noisy, so it's not just one reading. It's where things trend over time. There's a whole host of different things. And, if we think about blood pressure in particular, right, our blood vessels supply blood to all of our organs, not just our heart. And so when we think about the risk of high blood pressure on multiple organs, we think about from the heart perspective, every 20 points above 115 for a top number, the risk of dying from a heart attack doubles. From a brain perspective, about 51% of stroke deaths are attributable to high blood pressure. We know that people who have untreated high blood pressure in middle age have about 42% increased risk of dementia later in life. And high blood pressure, from the kidney perspective of things, is the second leading cause of kidney failure in the United States after diabetes. So one of the things to think about is that our blood vessels, they do a lot of work for us. And so keeping them healthy will not only keep the heart healthy, but other organs also. So the Advanced Comprehensive Hypertension Center is, to obtain this level of certification, it requires that you have specialists from multiple different disciplines that can treat the variety of hypertension and all the different causes of hypertension. And so there's multiple disciplines, variety of hypertension, the most significant and difficult to treat cases, and that we're engaged in cutting edge research and education of the next generation. And so all these things, there's a really high bar to clear to be considered and certified. And so we're quite proud of our team because it's a lot of work and a lot of people contribute a lot of time and effort into this.